Hello everyone. It's shortly after 9 p.m. in Doha. Hello from the newsroom of Northwestern University in Qatar. Wherever you are in the world, welcome to the Agora, the final session of Day 4 of Wish 2020. Everything has been packed away for the night. The place is deserted. If we're lucky, the lights will stay on for the next 30 minutes, but it's okay. I've got a small torch with me just in case they suddenly go out. If you're watching this, you are definitely one of the cool kids. If you've been with us for the last 8 hours, well, congratulations on your stamina. So, what are the Agoras? Wish Agoras are based on gatherings held at ancient Greek assembly places where communities would gather to share news and exchange views. Introduced in Wish 2018, this year we've moved our Agora conversations online because, well, pandemics have a habit of upending even the best laid plans. I'm Nick Bradshaw, Director of Outreach at Wish, and I'll be moderating today's session, which I hope will be informal and also engaging. And tonight, which posits the question, can social media ever really be a source of promoting good health? With me today, I hope, albeit virtually, is Dr. Mohammed Al-Banna, a well-respected Kuwaiti cardiologist who uses social media in Arabic to share accurate health messages. He currently has 60,000 followers on Instagram. We'll also be joined by a panel of 12 members of the Wish community who I'll bring into the conversation in a few minutes. But first, I'd like to speak to you, Dr. Al-Banna, to help get an overview of the topic we're discussing tonight. So, first question, why have you found social media to be the right tool for getting a message across, focused on promoting good heart health?
Nick, thank you so much for having me, and it's a pleasure to be here and amongst such a wonderful panel of distinguished individuals. So let me tell you that social media is gaining importance, and its importance is only getting bigger. It is here to stay. 80% of those on the internet use it for searching for health information. 75% of those users use social media outlets to conduct this search. And social media provides a 24/7 access to health information. The startling piece of information is that 90% of users think that the medical information on social media is trustworthy, and hence people go there to seek their medical data and answers to their medical questions. In the past, we used to expect patients to come to us as medical experts and as doctors. However, we have to go where the attention is. And I can tell you that people's attention is here. This is where all the attention is. And that's why we have to go seek our patients if we truly want to advance our cause and the goal of promoting health education.
So you mentioned there the 90%, that figure of trust. So how much responsibility do you have to make sure that the information you share is evidence-based? And have you ever been alarmed by what you've seen others posting on social media around healthcare?
So one of the reasons why I think, when people ask me, is what do you think of social media? I tell them my answer is this is a full-time job. It's another full-time job of mine on top of my other responsibilities because of the amount of time I have to spend researching, making sure that all the data I present to my patients is up to date and accurate. Just like it's available to you and it's easy access to you, it's also available to other health professionals who can come out and criticize you, number one. And then the other thing is, I try to maintain a certain level of credibility in front of my patients, my followers, and my audience. And that is why I think it's paramount to make sure that all the information that we present as healthcare professionals is evidence-based and is up to date. I cannot say that I've personally seen other people posting let's say, false data because I only follow people of a certain caliber, because I think that if I follow someone, I am actually endorsing them. And I'm telling the people that I follow,
Yep.
please go and follow this other doctor. So that's why I make sure that the people I follow also present up-to-date evidence-based information. But I know and I hear from people that there's a lot of, what should I say, there's lies out there that healthcare professionals have to stand up and contest.
If you were to go back a decade or so and kind of reset the way we use social media, particularly to share information around healthcare, what would you change? What do you think are the issues that need to, if you could step back in time?
So I'll tell you, I was at the 10 years ago, I used to think that social media is a fad. Social media is a bubble. It's going to burst. It's going to go away and disappear. And oh boy, I was proven wrong. If there's anything that I would do differently, I would go hard. I would go strong in social media, and I would have started earlier with my journey in health promotion and social media. That's certainly something I would do had I gone back in time.
Very interesting. So please stay with us. We will be coming back to you a lot, I'm sure. But we've heard from our expert there. Let's now hear from our panel. So welcome to our jury of 12 upstanding members of the Wish community who tonight can be found staring into their laptop cameras like rabbits caught in the headlights, just worried that we're going to say something or ask them something that they'll regret later. I hope they don't. I'm sure they won't. If I could ask you all to raise your hands if you have something to say, either a comment for Dr. Al-Banna or a question for Dr. Al-Banna. And if I could ask you to be brief so that we can hear as many different viewpoints as possible, and please don't forget to unmute your microphone if you want to be heard. So, panel, what role do you think social media can play in promoting good health? Who wants to start? Gentleman in yellow, Mahmoud, go ahead, unmute your microphone, please.
Me or... So
yes,
I have a question actually,
Mahmoud.
Dr. Al-Banna. I have a question to Dr. Al-Banna. It's first, it's two questions. The first question is, what did your colleagues think when you first started pushing those messages on your social media? And then the second question, or the second part of the question, is what do you think now, looking at the large number of followers on your Instagram? Because Nick at start said that you have now 60,000, so this is a great number.
So I have to say that my colleagues used to make fun of me. My friends, my colleagues, they all used to make fun of me and saying, oh, what do you think you are, a fashionista of some sort, showing yourself on Instagram and different social media outlets. However, as time went by, these friends have now come to me to seek advice on how they could advance and promote their own social media outlets. So I guess I've had the last laugh. Now, the second question is, sorry, I forgot your second question.
My second question is,
I think he
when
asked
you
what
look at the...
Go ahead.
Sorry. Okay, so I was asking, what do you think now? You have got large number of followers on Instagram.
So I have to say that this is not a large number of followers. I have colleagues who have started before me, and these are people that I used to criticize and I used to make fun of before I started the people on the campaign trail. And they have in excess of 1 million followers on Instagram only, plus other social media outlets. I am flattered, I'm happy, but again, it's a huge burden, it's a huge responsibility that one has to work hard to maintain.
Thank you. Looking to the other panelists, I can see gentleman in the glasses and the suit with your hand up, please. Yes,
Nick,
you.
Thank you. My question is to Dr. Muhammad related to the campaign that has been funded or sponsored by the National Bank of Kuwait to have everyday information about heart diseases. I think if you could just, highlight more about these experiences and how other countries could benefit, because I myself benefited from the everyday constant messaging related to certain type of diseases. So could we benefit and could we enlarge this scale through the power of social media? Thank you.
Yes, so the National Bank of Kuwait has been a big supporter of my health promotion endeavors. One of the campaigns was, as you've rightfully mentioned, is to come out with a heart-related piece of information on daily basis. I'm sure that we could, not just the National Bank, but any major institution through their CSR department can seek the advice of a specialist in other areas like gastrointestinal health, for instance, obesity, mental health. All these issues are hot topics, especially in the Gulf area, because the GCC is the #1 part of the world with obesity. It competes with the United States. We are #1 in complications of obesity. #2 is that mental health is looked at as a taboo here. People seek, I don't want to say anything, non-medical advice and non-medical experts for their mental health problems, thinking that they are caused from lack of faith and whatnot. And I think it's very important that we hit these areas hard and try to promote them to the public. So I highly advise any big institution to try and promote these two areas.
You mentioned mental health there, and I see Sarah is on our panel, I think. I don't know if Sarah, who I know works for a mental health organisation, if you have a comment you can make about your thoughts on social media and how it could be good for mental health and the problems that are faced around mental health.
Thank you, Nick, and thank you. It was very helpful to hear what Dr. Albana was saying. I think it's really important to break the taboos around mental health and make sure that there's accurate information available and that people feel without stigma that they can seek support and advice. It's really important throughout the world, including in the region. In terms of what the role of the social media, I think there's a few different things that we touched on some of them already. So some of it is around public health information. So basic information and regular provision of that information in a way that's easy to understand, and then to signpost to where services are available. And we have partners in different countries who are doing that. Second piece is around campaigning. So maybe raising awareness and support for particular conditions that are less well known or where there's a particular lack of information. We see that in our work. So we just worked with the World Health Organization on the design and delivery of their campaign for World Mental Health Day, which was #MoveForMentalHealth. And we had around 465 million views on that. And that was just on TikTok actually. And then we did it across a number of social media platforms. So we can raise awareness as well as engaging people at an individual level, even to find support in terms of services and in order to also find maybe communities where they can share and understand each other's conditions, and sometimes for peer-to-peer support in a more confidential setting. So I think there are a wide variety of ways. And then I think some of the challenges include the infodemic around COVID, which has been widely documented and discussed elsewhere. And then, of course, the very issue of social media as a form of addiction and how you manage people's consumption of media and time spent on social media. And that's really important. So those are some ideas. Thanks.
Very interesting. I mean, I'm going to stick with you for a second, Sarah. Do you sometimes think that you mentioned there how much you're doing? Can it sometimes be necessary to flood the markets with good information to counterbalance the bad information? Because it does seem that bad information gets out there much, much more easily because it tends to be more sensational. You know, something that's telling you that things are okay, they're doing this is a sensible, rational thing to do, isn't going to get as much coverage as something that is outlandish.
Yes, I don't think you can compete with a lot of TikTok challenges. I don't think any of us can, and that's just life. And a lot of social media is about entertainment as much as anything, or about shock value and all those things. But yes, there is a way of, I think you can use influencers. I think there's a really interesting question about how you engage with social media influencers. So to Dr. Albana's point, his following is high, but compared to some of the influencers that we know, it's very low. So it's partly about, can you work with influencers with very large followings and make sure what they are putting on their social media accounts is accurate? And sometimes we've actually worked with influencers with very big followings who are prepared to let a mental health activist or expert take over their social media account and then provide direct engagement with that fan base or that following. And that's a really effective way to reach a broader audience and, if you like, flood with better information. So there are different ways of doing it. Yeah.
I see a hand up there. Sorry, the lady with the lovely wallpaper in the background. Sorry if I'm being very vague there, but if you can unmute yourself.
Sure. Can you hear me?
Yes,
okay.
Yes.
So my question to both Dr. Albana and Sarah, in the conventional evidence-based methodology, we usually look at the evidence for conducting an intervention, and we try to find out what are the results that we find. How much do we know about the results of social media campaigns in terms of perceptions of people that have changed and practices that have changed because of social media campaigns?
I'll go first, Sarah. I have to admit that I haven't had the chance to look at research in this area, but I mean, this is obviously anecdotal information. This is just personal experience. And I can tell you that from the following, many people have changed their behavior based on advice, based on role modeling. You know, not only do I post about medical information, but what I do is I also post about my daily activities, my gym routine, the things that I eat, you know, the thoughts that go through my head. The whole point behind them is to try and instill a healthy lifestyle. And by doing that, I am hoping that when people see that their influencer, medical influencer, or that their doctor is walking the walk, that, you know, this would fare even better and make them pick up these habits and take advantage of them. Sarah?
Thank you. As you said, it's important to have evidence, and it's a relatively new area in terms of being able to test that. The other issue, of course, comes in terms of confidentiality. So if you look at the service that's well known in the UK called Samaritans, which is a listening service, they deliberately don't gather that data, so they can't measure the impact that they've had in that terms because of confidentiality. But there is a service called Crisis Text Line that started in the US and has been quite successful, and that does track at least what people are saying, what health they're seeking. And then the Heads Together campaign that was launched by the royal family in the UK, they measured when they increased knowledge and understanding around particular issues, did more people seek help? And they were able to see data that showed that the demand for mental health services rose as they started to raise the issue and reduce the stigma. So one of the challenges we have with social media is if you go out there and you flood the market with knowledge and understanding about a condition, you then have to be able to back that up with the services to provide support for those who realize that they need it. And that's one of the biggest challenges that we have with mental health. You're seeing that although there is a lot of taboo and stigma, as it reduces, people go to look for services. And if the support isn't available or it isn't in a form that they feel works for them, it can be a huge problem. And I expect that Dr. Albana has seen the same thing about the demand versus supply part, which social media can be a positive and a negative for.
This is so true, Sarah. You know, when I go out and talk about warning signs about heart attacks and whatnot, I get flooded, me and my colleagues, with people thinking that they might be having a heart attack, and it's like I have a twinge here or a chest pain there, and you know, you're absolutely right. I agree with you 100%.
So I'm wondering if anybody of our panel has or would admit that they use social media, they're influenced by what they see on social media in terms of their health. Galia, how about you? Do you have anything to add to this discussion? If you unmute yourself,
I wanted
please.
to add to this. Yes. Can you guys hear me? Yes, I just wanted to add to this already fruitful conversation about the stigma in relation to using social media. I think Mohammed and Sarah already capitalized on this point, and I wanted to say that I think this is why we view that's why we resort to social media as a means of an informal chat room. That's why a lot of people go there, like nowadays, especially during COVID, and because of the circumstances within the region, it's very hard to start a conversation. You don't trust in your local therapist. You reach out, you go on social media, see people relating to your experience. So I think it really highlights the importance of patient experience, and this is why people tend to go to social media, and this is why I tend to go to social media. I feel like it helps you start up like informal conversations, and it's very useful in that light. That's why there's a proliferation of podcasts and different mechanisms where people can go and reach out to people instead of using more traditional forms of dealing with their mental illness. So this is why I feel like we should view it in a positive light, and I want to know how we can capitalize on that and how we can build on that for the future, because there's so much opportunity, and for that to be a very healthy place and a very safe environment. I was right before this. I was in a seminar that talked about the importance of language in relation to mental health. So I wanted to know how we can use these two together and promote and using social media as a good platform for encouraging these conversations about mental health or any related health issues that we face today. Thank you.
Thank you. Something which was touched on there actually, and I'm going to bring something. I mean, I'm in Doha. I'm based in Doha, happily so. Our expert is based in Kuwait, and I'm interested actually in Kuwait. I've seen you, and I'm pretty sure that you will have seen as a doctor who's on social media that seeing you, being able to relate to you as a person on social media means that potential patients would feel more comfortable to then approach you. They know you're the sort of person they can talk to. And I'm aware that there are others. There's another social media influencer within the healthcare sector who talks about infertility and things like erectile dysfunction and the sort of things that people wouldn't be too comfortable necessarily about talking about, but you can get that information and you can kind of start a conversation that way. I mean, is that accurate? Is that something that you found in the Arab-speaking world, in this region, that it's been a really good tool for that?
I think it is, and it is. Sometimes it's sad when these influencers who talk about taboo subjects and get attacked. I personally know the person you're talking about, and I know others who are tackling very sensitive topics, and sometimes you find that their content has been blocked, their account has been blocked or whatnot, because some people think that these issues and these matters and topics should not be raised in public. Having said that, I think if not here, then where? Otherwise, all these taboo topics are going to stay hidden. Many people will suffer in silence, and they won't be able to seek the help that they need. I've had the chance to communicate with people who wanted second opinions, who had questions, and I've, even if I didn't have the right answer to their question, I would be able to send them to the right way or to the right person who would have the answer to their questions. So I think it is a very good medium to discuss topics of taboo and topics that are hidden, because sometimes you could join with a nickname, sometimes you could send a direct message. No one's going to know who you are, and you're going to be more comfortable discussing these taboo topics.
Thank you. Going back to the panel, we're getting to the last few minutes now, last couple of minutes. Does anybody else have anything they'd like to raise at this moment before we close? I see a gentleman with his hand up there, please, in the light blue shirt. Yep, waving at me now in the light blue shirt.
Thank you so much. My question is to Dr. Al-Banna. I know you said you follow only few select high caliber people on social media, but common people, they follow, they get their information from any kind of feeds. I have one example. Earlier this year, when the coronavirus was going high in India, there's a village in South India, in Andhra Pradesh. There was this information shared on social media that there's a particular plant. If you take a juice out of it and drink it, you will get cured from coronavirus. But 800 people got sick out of it, and they had no corona. They were all right, but once they drank the juice, they landed in hospital. So how can we tackle that? How can we tackle this disinformation, which is out there on social media? I know you already said that you follow a particular class, but the common people, they follow anyone around on the social media. How can we tackle that?
I mean, the only way to tackle it is if all healthcare professionals join in the effort to spread high caliber, evidence-based information. One person is not enough. 10 people are not enough. I was just talking to some of the one of the panels, who's members of the panel, who's a medical student, and I told him, I'm not going to be surprised if part of the medical curriculum is going to be in the future how to run a medical campaign or a health promotion campaign on social media, because more people need to be there to spread the right message to people. I mean, it's very easy. The same way that I have access to social media, everyone else has easy access to social media, and they can spread lies and fallacy without contest. And that's why medical professionals and experts have to take the responsibility of standing up for these people.
I think that's actually a great message to end this on. The idea that we can actually carry on, as you're doing, sharing good health messages through social media. I love the idea that it could be part of a curriculum. Well, we've reached the end of the Doha part of this Agora session. Thank you to Dr. Al-Banna, thank you to the panel. Thank you all for being a part of this. Anybody who's been a part, either of the panel, an expert, or has watched at home. I hope you've enjoyed this debate. That's it for day 4 of Wish 2020. We'll see you again tomorrow with an early Agora session around climate change and health, hosted from London by Dr. Ashley McKim of the BMJ. So tune in tomorrow. Until then, goodbye from Doha. Goodbye.